Well, the latest surge of coronavirus is certainly concerning. It's very concerning. And then there's a new, even more contagious strain of COVID-19. More than half a dozen cases have already been reported here in the United States. Joining us now is Will Humble, the Arizona Public Health Association, at one time the head of the Arizona Department of Health. Will, good to see you. Thanks, you for joining us. Sure. What's the story on the new strain? Is this something we need to fear? Is it helped by the vaccine? Where do we stand?
Yes. The number one question on everybody's mind, I think, is this going to change the effectiveness of the vaccines that are being distributed right now? The answer so far is no. There's no evidence to suggest that this new strain is going to, be able to hide from this new vaccine. So things look good on that, in that regard right now. It is a little bit, I think, disconcerting to learn that the new strain is spreads a little bit easier, and in particular, it looks like it spreads easier, especially on younger kids. One of the advantages that we've had with the current strain is, little kids seem to have, better outcomes, and it seems as though they're not as easily infected. This new strain seems to infect kids more readily than the current strain.
Now, Will, that's interesting because that then, of course, can have an impact on how we kind of figure out what we're going to do about schools.
Right, because I had earlier been really advocating for getting K-8 back in ahead of grades 9 through 12 because, of that very thing we just talked about. If it turns out that this new strain spreads more easily among those little kids, that'll complicate that theory that we could safely bring K-8 quicker back than 9-12.
How, since you're in this business, how do we know it spreads more easily? How did they figure that out?
Well, it really is an observational study. It's not anything that's an in-depth and ironclad study. It was a study that was really not a study, but more of a report that was put out by the English Health Department, not the UK, but in England. And they really did an epidemiological review of the spread, but it could actually be other things. Like
I was going to ask. Should we trust this? Should we believe it?
No. Here's the thing: it's not a peer-reviewed journal article. It's a report from the English Health Department, essentially.
Okay.
So, yeah.
Will, I want to get your take just on. There have been a lot of grousing, and people are frustrated that the vaccine is not getting out quicker. Do you favor more of a Florida model where you just say, "Hey, look, first come, first serve. Let's get the thing out there"? Do you think we've missed the mark here?
So Arizona's in 1A, and I think the approaches that the counties are using for 1A, which is really an employment class, healthcare workers, and people living in nursing homes and assisted living centers, I think the approach in 1A has been okay. I think you really need to change it when you go to 1B. In Arizona, we got 7.2 million people. Guess what? 1 million people are in 1B. Wow. I don't see how you can have this mass vaccination type model with just a few sites to vaccinate that many people. I think it needs to be far more distributed. And I'm a big proponent of getting it into pharmacies. If we could get it into 1,000 pharmacies across the state, if they vaccinated 50 people a day, that's 50,000 per day. That's over 1 million a month.
Totally with you on that. And California spread it out and said dentists should be able to do it so that they can get out there.
Dentists, pharmacists. There's a lot of professionals that have that in their scope of practice, and I'm all for it.
One more thing. I keep hearing that half of the vaccine pool has been held back to make sure that people who get it get the second shot instead of just going out and scattershotting it and then saying, okay, let's get that second wave of the vaccine in and then do the second shot. You follow me?
Yeah, that may be the case in some states, but in our case, that's not the case. There's so much in freezers right now that there's nothing. It's sitting in freezers at this point.
That's terrible.
Yeah, no, we got to do better. That's for sure. And there's been some promises made now by the governor. We'll see if he follows through.
Will Humble, great to see you.